Exposure and response prevention, ERP. What is the goal of ERP?
Right. So most people think that the goal of ERP is, number one, to get rid of the thoughts.
Right.
That's by far the most misunderstood element of the entire basis of therapy.
Right.
You know, what can I do to get rid of the thoughts? And it's really so critical to understand the thoughts are not the problem. Research shows over and over again, all human brains create these very bizarre or novel or unusual associations. I haven't had a moment of OCD, and my brain comes up with endless array of creative ideas. Every time I'm on a cruise ship balcony, my brain tells me jump.
Right.
Every time I'm around my little doggies, my brain tells me kill them. And so, you know, my brain has an endless menu.
Right.
Life gets frustrating, my brain says, you know, take your shotgun and blow your head off.
Right.
Endless menu of ways in which our brains are endlessly creative. My brain, when it shares these things, there's not a lick of anxiety.
Right.
Just to use a word that your little holler would use. I would never use that phrase. And so critical, the goal of therapy is not to get rid of the thoughts. The thoughts are completely meaningless and irrelevant.
Right.
They don't indicate anything about a person's character. So if you have thoughts of violence against others, it doesn't mean you're a violent person. If you have thoughts against God, it doesn't mean there's anything about your relationship with God that needs to be addressing. Right. And so many therapists spend a lot of time talking about the content of the thought, which is completely antithetical to, meaning the opposite of the actual therapeutic agenda.
Gotcha.
This is probably one of the most basic yet most common, misunderstandings that exist within our field with this condition.
Right. So the goal of exposure and response prevention is not to get rid of the thoughts.
In any way.
The goal is to be irrelevant towards those thoughts.
Convey irrelevance.
Convey irrelevance to those
And
thoughts.
so the goal also of therapy is not to get rid of anxiety. A lot of patients, when they're very compliant and aggressive with the index card therapy, will say, when I write down the spike on an index card, I get tremendous relief. It's like the brain sees that I'm going to be using this card to mimic its spike theme.
Right.
And the brain just says, okay, I'll go away. And so the patients become a little bit dependent on the idea that, oh, look, if I do an index card, I'll feel better. And then, lo and behold, they'll do an index card and not feel better. And they'll think, it's not working anymore. The therapy broke.
I experienced some anxiety.
Right.
Does that mean I'm doing something wrong?
Exactly. And so what's so critical is to understand that the entire goal of ERP is the conveyance, the demonstration of irrelevance of the brain signal, predominantly the emotional one, because the emotions, as we said, can attach themselves to any topic.
Right.
And then to show the irrelevance of the actual topic in terms of not engaging with it, but being kind of welcoming and permission giving of the brain's activity, both the emotional distress signal and the cognitive element. And so by engaging in exposure therapy, we show that we're willing, whether it produces the association or we do it voluntarily, equal relevance, equal meaninglessness. And the beautiful thing about our brain machines programming is over time, the brain machine says, oh, my signals are irrelevant, and it's designed to dial down because the brain is a beautiful machine that's designed to not waste energy.
Right.